Dr. Gina Agiostratidou of the Helmsley Charitable Trust and Dr. Kurt Griffin of the Sanford School of Medicine at the University of South Dakota will discuss a program to screen for type 1 diabetes and intervene in the progression of disease. Medical science may be on the brink of an unprecedented accomplishment, detecting which babies are at risk to develop type 1 diabetes before it becomes clinically evident. This could allow for early intervention aimed at delaying the onset and even prevent the clinical manifestations associated with this autoimmune disease. Research that has enabled this remarkable achievement has been steadily advancing over the years. Now it is time to put scientific theory to the test. But the kind of clinical trial required takes dollars and especially time, while millions around the world continue to live with a life-threatening disease. That is where public, private, and academic partnerships can accelerate our ability to improve human health through innovation. A new program designed and funded by Helmsley Charitable Trust and Sanford Research is precisely the kind of collaboration that could make type 1 diabetes prevention a reality. Here's how it's working.
I'm Kurt Griffin. I'm a pediatric endocrinologist at Sanford Health, and I have the privilege of directing the clinical trials for the Sanford Project, which encompasses all of our type 1 diabetes research. One of our new and exciting programs is our PLEDGE study. This is general population screening for type 1 diabetes risk and celiac disease. This is a disease that we have a treatment for, which is insulin, and 100 years after the discovery of insulin, we still don't have any way to take care of the underlying problem that leads up to type 1 diabetes, which is autoimmunity. Type 1 diabetes is an autoimmune disease that develops silently and over a prolonged period of time, and we are now getting some evidence that there may be some ways where we can slow it down if we know who's on that path to getting it. Unfortunately, many of the children who present with new onset type 1 diabetes do so at a very advanced stage when they are in a state called diabetic ketoacidosis. Even that single episode of ketoacidosis at diagnosis is associated with worse blood sugar control for some years afterwards. And there's evidence that it actually has effects on brain development just from that single episode. Most of the families that find themselves in that situation had no idea that this was coming on. We now have ways to be able to predict and detect early who may be heading in that direction by measuring autoantibodies that are relevant to type 1 diabetes. These are antibodies that are markers that the immune system is starting to attack the pancreas in a way that it really shouldn't be doing for the rest of us who are healthy. So we're now at the point where we're beginning to get a little bit of traction against the autoimmunity. And one of the things that we've been thinking for a long time, and now we have our first evidence, is if we can treat this earlier, we may be able to stop it, or at least slow it down before it gets to the point that a child is actually sick and needs insulin. In order to do that, we need to know which children are on that path and who might actually benefit from that intervention. Diabetes TrialNet has done a wonderful job screening family members of people that already have type 1, but the math of this works out such that the vast majority, 90% of the people who are going to get type 1 diabetes don't already have in the family and they're not eligible for these family screening programs. So in order to be able to catch these kids before they get sick, we really need to expand the screening so that eventually we can offer this to every child. So the PLEDGE study, like many, has taken a while to get to this point. It is something that really, I think, leverages what is special and different about Sanford as far as being an integrated health system. And from the time that I arrived at Sanford in 2013, I've already been talking about how might we be able to move to this eventually. And then there's the serendipity of, who one meets at meetings. And in 2017, I happened to be in the takeaway line for lunch in San Francisco behind Ran Jenny Thomas from Australia, and we got to talking about her ideas for screening and what might be able to predict who goes on to develop the autoimmunity. And we started developing a project from there, and that's where the PLEDGE name originally took hold. And if we fast forward 18 months, at the same immunology of diabetes meeting, this time in London, I sat down with Anne Korolova from the Helmsley Charitable Trust and began to have a deeper discussion about the overlap in mission and interest and ability to do this project at Sanford, matching with the interests of Helmsley in funding these sorts of programs.
The goals of Pledge is to screen children for the risk associated with type 1 diabetes. We chose to work with Sanford because we want to be proactive versus reactive. Also, Sanford is an integrated health system where we ensure that children who have the risk associated with type 1 diabetes are going to be taken care, they're going to be educated about type 1 diabetes and live a better life. Sanford's efforts will help us understand how this is possible in a real-world setting. We have a long view and a sense of urgency. In our program, we focus on improving the lives of people with type 1 diabetes while we fund research and technology advancements for a better tomorrow. A better tomorrow that includes universal screening like the one that Sanford is testing. At the same time, we support clinical trials in Europe with a goal to prevent type 1 diabetes. We would like to see universal screening becoming a standard of care for all children in the US and globally. We are optimistic that one day every child with risk of type 1 diabetes will have access to a treatment that can stall autoimmunity and type 1 diabetes.
There's clear evidence that the children who develop type 1 diabetes at younger ages, many of them already have antibodies certainly by 1 or 2 years of age. To measure autoantibodies, we need just a tiny little bit of blood. We're trying to match our collection schedule with when children are tending to come in for vaccines and sometimes are routinely having blood drawn already. In that case, we're able to piggyback on the blood collections already done and just get a little bit extra for the Pledge study. While the Pledge study is designed to capture children starting at birth, we are welcoming enrollment of any child up until their 6th birthday.
My name is Allison Gates, and I live in Sioux Falls with my husband and 2 kids, and this is Lily, and she's participating in the Pledge study. I was really interested in having Lily participate in this study because my sister had been diagnosed with type 1 diabetes when she was really young, and I saw some of her struggles and how it kind of affected her life, and if there was any way that I could learn more about it or help my kids if they were predisposed to type 1 diabetes, I really wanted to do that. It's just a simple finger prick to kind of collect the blood, and that's what they would be testing, and then we would find those results. So it seems like, a quick errand that can really give us a lot of information that would be important for the future. And so it seems definitely worth the very minimal effort that we had to put in to participate in this.
So the parts of Pledge that are really innovative have less to do with the assays that we're using and more with how we are implementing them, and the extent to which we can integrate them into the routine care that children are already coming in and getting. We really try to leverage an established workflow, so we're not trying to invent something new, but rather take advantage of what's already happening every day. The autoantibodies are analyzed in batches, so once we get enough samples, they're shipped all together to our collaborator in Seattle who runs the autoantibody assays. These are being performed on a CLIA-certified platform, so the results are clinically actionable. Fortunately, the vast majority of these are going to be negative. For those few people that do have a positive result, we will reach out to them by telephone and ensure that they understand what the positive result may or may not mean, and then connect them and be sure that we have a way to monitor them going forward so that if somebody is on that path to diabetes, we have a way of catching them before they get sick. If and when they get to the point where they need insulin, we can start that early before they get very sick and before they come in ketoacidosis. That by itself has tremendous impacts on how well they do after the diagnosis, as well as obviously saving the cost of an intensive care admission. Right there is a significant impact financially as well.
We're trying to assess if oral insulin, for example, can prevent type 1 diabetes. I'm asking you to unite with us because prevention is a very, very difficult and complicated effort. I'm asking you to unite because we all want a life without disease.
Type 1 diabetes isn't a short-term diagnosis, it's a lifelong thing. Being able to educate yourself as a family, I think, is very valuable. There's not a lot of things you have to do, like a finger prick. That seems pretty doable, right? We can do that.
The data that come out of Pledge are exactly the sort that are going to be necessary to assess whether this is ready to be moved into routine standards of care for all children. The Helmsley Charitable Trust and other organizations are already talking with the groups that establish standards of care for children in order to learn what is necessary to be able to bring population screening for type 1 diabetes into those standards. So the opportunity to be contributing to something that could touch every child in the United States and beyond is really awe-inspiring.